Dear viewers, on this occasion, I'm gonna share with you very important 5 tips to prevent cervical cancer silent but deadly. These are words often used to describe cervical cancer, a slow-growing disease that rarely causes symptoms in its early stages. Cervical cancer is almost always caused by the human papillomavirus, HPV, the most common sexually transmitted infection in the United States, affecting approximately 79 million Americans, and HPV can be detected in 93% of all cervical cancers. This particular virus alone is not sufficient to cause cervical cancer. Other contributing factors like smoking, poor nutrition, a weakened immune system, and pregnancy aid body in developing cervical cancer. HPV is very common. Up to 80% of sexually active people have been exposed at some point in their lives, said by Summer Dewdney, a gynecologic oncologist at Rush University Medical Center. But the vast majority never develops any symptoms, and the body's immune system can usually clear HPV on its own within 2 years. In some women, however, certain strains of HPV cause changes to the cells in the cervix, which then can become cancerous. Dewdney offers 5 tips for reducing your risk of cervical cancer. Number 1. Go for routine Pap tests. Pap tests enable doctors to detect abnormalities, changes on the cells on your cervix, and take action before cervical cancer develops. Women should have a Pap test at least once every 3 years, beginning at age 21, Dewdney says. Once you turn 30, we recommend Pap smears every 5 years as long as you have HPV testing with your Pap and the results are negative. In addition, any bleeding with intercourse should be evaluated by a gynecologist, she adds. Number 2. Follow up on abnormal Pap smears. If an infection is present, your doctor will treat you and repeat the Pap test at a later time. If the examination or Pap test suggests something other than an infection, your doctor will perform other tests to determine the problem. In some cases where women had prior abnormal Pap test results, doctors may also perform an HPV DNA test, which can detect HPV on a woman's cervix. Number 3. Get vaccinated. We have a vaccine for cancer, Dewdney says. 2 vaccines, Cervarix and Gardasil, are available to protect against the types of HPV that cause the most cervical cancers, as well as anal cancers in men. Your doctor can administer the vaccine in 3 shots over a 6-month period. Gardasil is recommended for girls and women between the ages of 9 and 26. Cervarix is recommended for girls who are 9 years of age, plus women of any age who have not previously been vaccinated and have not previously been diagnosed with cervical cancer. The HPV vaccine is also recommended for boys, starting at age 11. Number 4. Practice safe sex. Studies have shown that women who have many sexual partners increase their risk of developing HPV and their risk of cervical cancer. And if you are sexually active, use a condom every time you have sex, Dewdney adds. Unprotected sex leaves you at risk for contracting sexually transmitted diseases that can increase your risk of getting HPV and greatly increase your chances of developing precancerous changes of the cervix. But while condoms help to lower the risk of developing HPV-related diseases, including cervical cancer, be aware that HPV can infect areas that are not covered by a condom, so condoms may not fully protect against HPV. That's why it's essential to get the HPV vaccine in addition to using condoms. Number 5. Quit smoking. Smoking cigarettes doubles your risk of developing cervical cancer. Studies have shown that tobacco byproducts damage the DNA of cervix cells and may contribute to the development of cervical cancer. I hope this video will increase your knowledge. Please share on Facebook with other fellows, may beneficial for them. Thanks for watching the video. Please subscribe it, for latest videos.